Yeah.
So good afternoon, everyone. My name is Jessica Valdez. I'm gonna be your benefits agent this year. Super happy to be back, guys. We are recording the meeting, so if you have any questions that you don't want recorded, I'll be here after. We have a sign-up sheet if you want to do a one-on-one to kind of discuss the options. I'm here to help throughout the enrollment process, okay? So I want to give you a reminder of our team because we're here to help when it comes to anything and everything with the benefits, okay? So if you're having any issues with claims, you're having an issue with a prescription, prior authorizations, please utilize our team. We have a claims team and that's all they do all day. They'll coordinate with the provider, they'll coordinate with the carrier to make sure you're getting the right answers and we're resolving whatever issues arise. For minor things such as finding a doctor, ordering an ID card, our service team is here to help. And now throughout the enrollment process, you have myself and Karen who will help if you have issues logging in, or she'll even help you elect if you have issues going through the process. Everyone must go on to Employee Navigator and elect or waive their benefits. If you have a life insurance, so you want to make sure you're updating that beneficiary. So everyone must go in, even if you're going to waive all the benefits. And my email is the same as my team's. It's just going to be my name, jessica@fdnational.com. So if you want to write it down in the booklet, feel free to CC me and I'll be on top of any questions that are sent to our team. You want to pass those on? So we're in open enrollment time. This is the time to make your changes. So add coverage, change coverage. Throughout the year, you can only make changes if you have a qualifying event. So some qualifying events are marriage, divorce, birth or adoption, Medicare entitlement, or involuntary loss or gain of coverage. So let's say your spouse has open enrollment in January, and in January you decide you want to get on their plan. That is involuntary gain of coverage. That would be a qualifying event. But you can't just terminate the plan because you decide you don't need it anymore. So when you're making your elections, make sure it's benefits that are going to work for you from June to next June, okay? Everything will take effect June 1st. Eligibility, you're eligible to get on the plan if you're a full-time employee. After your waiting period, which is first of the month following 60 days, you're able to enroll onto the benefits. Dependents, you're able to add dependents, your spouse, and you're able to add children up to the age of 30. The children should be unmarried or have no other children of their own, and they would be considered a dependent.
And that changed, everybody. It used to be what?
26.
26 now. With Blue Cross, it's 30.
Okay, so this little page is super important. I wanted to give kind of a summary of the plan so that you make sure you pick the correct plan for you, because there are some key differences with the plan, okay? So your Blue Care option is going to be the lowest cost option. It's a Florida only network. If you're traveling international and you have a situation that's life-threatening or emergency, where you have to go to the hospital, you can go to the hospital as if you were in network. But if you're in Colorado and you have a cold, you can't see a doctor there. You break your leg, you can go to the hospital, okay? So anything life-threatening or emergency, it would work, but it's a Florida only network. It's a generic only drug card. Okay, so if you take preferred brand medication, you take medications, this one only covers generics. 90% of medications have generics, but I want to emphasize that so that you pick the right plan that's going to cover you for your health situation currently. A great thing about Blue Cross Blue Shield is the mental health, there's no charge. So if you see a therapist, psychiatrist that's in network with Blue Cross Blue Shield, there's no co-pays for the therapies, which I think is a great benefit. Your mid plan is going to be your Blue Options plan. This is a national network. So this is Blue Cross's biggest network, okay? This will have a full drug card and it's a middle cost plan. Mental health, there's no charge. Then the difference between this one and this one, this is also a national plan, also has the full drug card, but this one has a lower deductible. So if you have specialty medication, which usually applies a deductible, this is the option that you're going to want to go with. Okay. Same thing, mental health, no charge. We have two gap options. We're moving back to Transamerica. So the first gap option is gonna give you 7,500 for inpatient and outpatient. I'm gonna go line by line with the benefits guy, just wanted to give you an overview. Covers ambulance at 2,500 and lab testing. The second option is gonna cover your inpatient services, your outpatient services, ambulance, physical and chiropractor therapy, infusion therapy, DME, and lab testing if it's even done in the doctor's office, okay? So this is a little bit more of a robust gap. You have the two options.
Sorry, and this gap is not like the one that we currently have. It's not gonna be copay, that reimbursement. So I know a lot of employees will send out right now to our current provider with the receipt and the EOB, and then you
reimbursement.
get reimbursed for the copay that you paid out. This one is not that way, okay?
So to reiterate, the difference, what this doesn't cover is it doesn't cover the co-pays for your doctor, your specialist. So we had Transamerica 2 years ago, same thing, it's the only difference is your PCP and specialist co-pays are not covered by the gap, okay? So now let's get more into the benefits. So your base option, which is your lowest cost option, is the blue pair, and I'll kind of go through all line by line. So option one, you have a PCP copayment of 30, option two is 30, and your buy-up plan is 35, okay? If you're going for your annual wellness visit, that copay is waived. Specialist for the first plan is 60, second plan 55, third plan 85. If you're going for your annual exam women for the specialist, that copay is waived. Virtual visits using teledoc. If you're talking to a general practitioner, there's no cost for that. If you're talking to a specialist or a therapist, well, no, therapy's free. Talking to a specialist, there would be the specialist copay through teledoc. Minute Clinic, 30 for the first two, 35 for the second. So as I mentioned, the gap does not cover the doctor co-payments and your medication co-payments. So your PCP, specialist, virtual visit, Minute Clinic fall under those doctor co-pays, okay? So what does the gap cover? You have two different benefits, 7,500 twice and you have 6,500 twice. And that's because you have two different benefits with the gap. The first 7,500 or 6,500 is gonna cover outpatient services. Your outpatient services are urgent care, ER, your minor and major diagnostic, and outpatient surgery. Your second benefit is if you're hospitalized, meaning you're in the hospital for more than 23 hours, okay? So if I go to the urgent care for plan one, I have $100 copayment if I do not choose the gap. Plan two, 60, plan three, 100. If I have the gap, I show my Blue Cross card, I show my gap card, I pay $0 for that urgent care visit. Think of the gap as a gift card. As you go using it, the amount's gonna go down. You always wanna show that gift card or your gap card so it covers your copay and you don't come out of pocket, okay? ER, so for the first plan, your ER applies your deductible of 7,500, which is why we picked a gap of 7,500, so that your deductible would be 100% covered by the gap. It's 20% after 7,500. When people see the co-insurance, they say, what if my bill's 100,000? I have to pay 20% of that. No, you don't. There's an out-of-pocket maximum of 8,200. So in your worst case scenario, even if you go to the hospital every single day, your out-of-pocket's 8,200. After you've paid that, Blue Cross will cover you 100% for the year. So if I have a gap of 7,500 and my out-of-pocket's 8,200, in my worst case scenario, I would be paying the difference. Is anybody really good at math that can say that off the top of their head?
1,000.
700 is the worst case scenario. So that would be for plan one. Plan two has a $300 copay for ER, and plan three, a $350 copay for ER. You know, when you go to the ER, sometimes doctors come and they talk to you and they send you a separate bill. So their separate bill would apply the deductible. Usually the biggest charge is the facility charge, but you have the gap that would cover. Okay. Your minor diagnostics, if you're doing them at Quest, there's no cost. X-rays, $65 in plan one. For plan two, it applies your deductible and co-insurance. The deductible for plan two is $5,000. And as you can see here, the out-of-pocket $6,350 for both of these plans. So we picked a gap of 6,500. So if you chose any of these two plans, anything that the gap covers, you would pay $0 because the gap covers your out-of-pocket. So if you choose the mid plan or this plan for urgent care, ER, diagnostics, surgery, and hospitalization, you're gonna be 100% covered. Like you're not gonna pay $1.
As long as you have the gap.
As long as you have the gap, okay?
If not, it would apply your deductible. The last plan, Zero for Labs, independent diagnostic testing center for X-rays, a $50 copay. Gap will cover that if you have a gap, if not, you're coming up. So if you don't choose the gap, you obviously have these copays or deductible. If you choose the gap, it'll help cover those costs. Major diagnostics, $300 at an independent facility. It applies your deductible and co-insurance at the hospital. The mid plan applies your deductible and co-insurance, and the last plan has a $350 copay. Major diagnostics can range between $300 to $800 depending where and what you're having done. A lot of people don't know, but you could shop your major diagnostics. So if you go do it at Baptist at the hospital, it might be $900, or if you go do it at, Coral Gables MRI, it might be $200. So if you ever have to do a diagnostic, our claims team can help you, give you a list and let you know so that you can not use as much of your gap benefits, especially if you have this one where you have that little hole between the out of pocket and your outpatient surgery. So if you do it at an independent facility, it's $250 copay. If you do it at the hospital, it applies 20% after your deductible. And by hospital, it also means hospital affiliated. Okay? Your gap, you have $7,500 that your gap would cover. For this plan, it applies your deductible and 30% co-insurance. So let's say that your hospitalization is $6,000. You would pay the first $5,000 and then 30% of the difference of $6,000 and $5,000. So you would pay $5,300. You have the gap, it will cover that. You would pay $0. Now you would pay that $5,300 for that $6,000 surgery. You would meet your deductible for the year. For the last plan, it's a $300 copay at an independent facility. You do it at the hospital, it applies your deductible. So as you can see, everything done at the hospital is usually a little more expensive. You choose the gap, it would cover that. Hospitalization for the first plan. Worst case scenario, because we know hospitalizations are expensive, I always like to look at my out-of-pocket as my worst case scenario. So if I'm hospitalized with plan 1, I don't choose the gap, I'm on the hook for $8,200, worst case scenario. If I have the gap, I only pay $700 because the gap's gonna cover that difference. If I have the 05302 without the gap, worst case scenarios, my out-of-pocket right here, $60,350. Same thing with the last plan, $60,350. But if you have the gap, you pay $0 in the hospital. So I know we just kind of went over 3 plans, 2 different gaps. Let me stop there. Any questions?
Can you repeat the whole thing?
Like, I'm out of breath. Okay, remember, when you're going through Navigator, you're gonna see that the $6,500 gap is a little more expensive than the $7,500 gap. And that's because this gap has all the bells and whistles, okay? So it's not a typo, just that this one does cover more things like we mentioned earlier, the DME, infusion,
Copay.
therapy, all of that.
So,
Yes.
so now how the gap works is that only present the card and that's it, right? We don't need to contact anyone, we don't need to write emails, we don't need to wait for a check.
Yeah, okay, so you should be showing your Blue Cross and your gap card, right? What happened last year is a lot of doctor's offices don't fill the gap, so that's why you were in that process. That's why we kind of removed that this year because it became more tedious than a benefit. If you go to do an MRI or something and that provider does not fill the gap, we can call and provide the information, but there might be a chance that we have to do that process. It's not as common for these services, but there is a chance, okay? Any questions? With the drug card, so as you see here, it says up to $10 for generics, 20% for preferred brands, and non-preferred brands does not cover specialty medication. So only generics for this one. These 2 plans have the same drug card, up to 10 for generic, up to 50 for preferred brand, up to 80 for non-preferred, and it applies your deductible for specialty. So that's why I said if you take specialty medication, or you have a $2,500 deductible, this would be a better fit for you. Okay, these 2 plans are PPOs, meaning you can leave the network as you.
I'm sorry, I
Yeah.
have one question. So are you saying that the gap will cover on the prescription as well?
No,
Oh,
no,
oh, okay.
no, not covered by gap.
Oh, okay, okay.
I wish, but no.
So the maximum out of pocket on level 3 for prescription would be the 2,500?
Would be, it applies your deductible $2,500 and then 20% co-insurance up to 60.
So they have to go through the whole process of
Yes.
other stuff?
Yes,
Okay.
now, if you take specialty meds, reach out to us, we'll help you
Right.
get the copay cards and all of that, and hopefully it'll be no cost. Hopefully. You have a PPO, you can leave the network. As you can see, when you leave the network, the deductible doubles, right? So you have, there's a very gray area when you leave the network, because let's say I have a client that she goes to a therapist who's out of network. A therapist charges $300. In network, the contracted rate is $150. So they only apply $150 to this out of network deductible, not the whole $300. So you have some coverage thing in a catastrophic situation, but there are some limitations. If you're ever in any of those situations, reach out to our team and we can walk you through that. I always like to point that out because there is some gray areas with out of network because they don't have contracts with care. Any questions on this? Blue Options, Blue Care, 2 different networks. Dai sent us a list of doctors. We checked them. Sure, she reached back out to you. You want to double check if and you're between Blue Care, Blue Options, you can do it here. We have everything linked on Navigator as well, or you could reach out to us.
Jessica,
Yes.
what's considered a specialty medication?
Like a specialty medication is an injectable. If you were taking a specialty medication, I think you would know because you have to go through a process of getting prior authorizations. But if you want to send me an email of any medications, I could tell you how to apply. I'm pretty sure we already did that exercise. So we have all the medications. And Dai has all of those answers, but you could reach out to me directly as well.
Okay, and are durable goods part of this as well?
Durable medical equipment?
Medical, yeah.
Okay, yes, so that applies to deductible, but this gap covers the durable medical equipment.
Okay.
Any other questions? Okay, so we just kind of wanted to remind you on what care to use when, because number one, it's gonna be less cost for you, and number two, less cost for the plan, which means less increases for us. So we kind of want to remember where to go. So you want to do your virtual visits for minor things that you could show over the phone. You have your PCP for monitoring chronic conditions or minor conditions or your wellness visit. Your minute clinic, let's say you have a throat ache, you want to do a test, you obviously cannot do that virtually, so you could use your minute clinic for minor infections, flu shots, things like that. Your urgent care will be for, coughs, sore throat, minor injuries, flu, colds, some of them do diagnostics. And then you want to go to the emergency when it's truly an emergency. As you can see, it applies a deductible, it has higher co-pays, so make sure you're going to the emergency when it's truly an emergency.
Yeah, and the reason we point this out, guys, so much is because every year when we come to renewal, it's all based on the use from the previous year. So obviously, we're not asking anybody to minimize their care. We're just asking you to be wise on, where to go first. Like, why would you go to the emergency room when you can get it solved, whatever, at a PCP? You know what I mean?
It's not that we choose to go through this and change our carriers.
Yeah, exactly.
Trust me.
So your dental and vision benefits are staying the same. They are with United Healthcare. We did add this little disclaimer because the DHMO has a network in almost all the states, but there are a few where there's no coverage. So just in case any remote employees or someone that travels a lot and you just know where there's coverage for the DHMO. Your DHMO is like a discount dental plan. You're gonna have a breakdown of a copay for every single individual service. That is linked onto Employee Navigator. So if you just do 2 cleanings a year, that could be a good fit for you. If you have to do additional work, then you want to look into the PPO because the PPO is going to cover a percentage of costs. So it's going to cover 100% of 2 cleanings per year. It's going to cover 80% of your basic services, so general treatments, simple extractions, and then 50% of your major services, so oral surgery, endodontics, periodontics, crowns, dentures. Your $50 deductible will apply after your basic and major service.
Is that 80% or 50% of an agreed amount?
It's great question. So in and out of network, it's gonna cover 80%. How I mentioned with the medical, right, is if you leave the network and that dentist wants to charge you $500 for an extraction, but in network, it's $200, United's gonna cover 80% of what it would cover in network, the 200, not the 500. So if you're not married to your dentist, I always recommend looking for a dentist in network so you have more coverage. However, if you have a dentist, they don't take insurance, you can still submit for coverage.
but they can charge a little bit more and you would be paying for that. Great question.
Orthodontics, $1,000 for children, that's a lifetime maximum. So if you used it for your child last year, it doesn't refresh every year, it's gone, okay? No waiting period and it's unlimited. So if you have to do, 5 root canals, I don't wish that upon anybody, but it's unlimited. It'll cover 50% of those 5 root canals for you. A little tip. I always tell my clients, ask for a pre-estimate when you're in the dentist office. Takes like 2 to 3 weeks. You can call our office. We can try to expedite it if it's something urgent, but they will submit to the insurance. Hey, these are the services that Claudia needs done. And then they'll tell you, this is what I covered. A lot of times you go to dentists or like Spirit Airlines, there's always surprise charges. This way there's not. They have to honor that pre-estimate. Okay, so if you have to get work done, I always recommend. Your vision plan, so your major medical, your dental, all of those benefits refresh with the calendar year. Your vision plan is 12 months from your last visit. So if I went today, I would wait a year from today to go do my annual vision exam. And I have a copay of $10, an additional copay of $25 if I'm doing an exam for glasses or contacts, so you're really looking at $35. And then $200 to use towards frames or contacts. Warby Parker's a network, they're a popular, yeah. And if you scratch your glasses within a year, they'll send you a new pair. Yeah. So I always recommend Warby Parker, but you have $200 to use and they give you additional discounts off the frames, not the lenses, but off the frames. Any questions on the dental?
It's either frame or contact.
Either
right?
frame, either or. Any questions?
For the contacts?
Yeah.
Do you have like we have to order them through the doctor's office or like online, we can like submit, we do like a 1-800 contacts, for example?
So you have to go to the doctor to get the prescription, but you can do it through 1-800 contacts with submitting your prescription and putting your insurance information. Okay. Any questions?
No, it's a lot, guys. We're almost there.
Tomorrow you'll have questions.
Yeah.
It's a-
That is thinking.
No, what's the
Yeah.
last day? What's the last day? That's when you're gonna get the question.
Tomorrow.
I'm here for all the questions. I want to make sure you guys choose the right plan so there's no surprises and we're happy throughout. So your United Healthcare life insurance, the death benefit is 2 times the salary. So if I make 50 grand, my death benefit is 100 grand. When you're going through Navigator, make sure you put an updated beneficiary. So we can update it with United. You want to have an ex-husband on there, and God forbid something happens and he gets the death
Oh, no.
benefit.
Oh my God. Sure has.
I'm sure it has.
Uh-huh.
It also cannot be a minor, so if you want to leave it for your child, you need to leave it for a responsible adult. That will put your money for the benefit of your child. It has an AD&D, God forbid, you lose a limb, they will accelerate that benefit for you. And I hope none of that happens, so we have that whole benefit summary linked in Navigator for you. And then at age 65, they do reduce the death benefit by to 65%, and at age 70, they reduce it to 50%. Okay?
Discrimination.
Okay, I'm seeing Hopefully
Hopefully you're not working at 70. Long-term disability, so if God forbid you're disabled, after 90 days, long-term disability will kick in. It'll pay 60% of your monthly income up to a maximum of $1,500. It'll pay that as long as you're disabled or up to retirement age. AFLAC has short-term disability. So that's a benefit if you want to look to make sure you have that. What will happen within those 90 days? That's a good benefit to speak with Marissa about. MetLaw Legal. So this is a benefit where you have access to a network of lawyers. Basically, they can help you with all of these things. So if you have your life insurance, you have additional life insurance, you haven't done your will, your estate plan or anything like that, they can help you with all of that. So this is an additional benefit that your flexible spending account, so the maximum did increase. You have an increase, maximum of 3,200. For your healthcare FSA, you could use that for healthcare costs. So like I said, the GAP doesn't cover prescriptions or the co-pays to see the doctor, but you could use your FSA for that. It also covers dental or vision costs. So if you have to do dental work,
you know, you're probably gonna hit that maximum, so
And this went up this year, right?
it went up, it goes up every single year. There's also a website called fsastore.com that has every single FSA product linked, and you'd be surprised the stuff they have on there that are FSA eligible. So I always recommend going on there. The plan year begins in June. So with FSA, if you don't use it, you lose it. So if you have anything above 610 that you don't use, July 1st, you lose that money.
So that went up too. It used to be 500.
It
right?
goes up, yeah, they both go up.
Good.
So please make sure you're using your funds, go on the FSA store, Mother's Day is coming up. And use your funds, anything in excess of 610, okay?
I thought I saw something that was 650.
Since you guys are plan year, not calendar year.
Okay, I did see that number,
But after-
okay.
Yeah,
After you left my.
Ah,
office, they
okay.
gave
yeah. Sorry.
No problem, no problem.
Dependent care FSA, you have a maximum of 5,000 to use for dependents up to the age of 13. You can use it for preschool, nursery, daycare, summer
Oh,
camp,
wow.
after school or babysitter. You cannot use it for private school. There's no rollover. There's only a grace period. So if by July 1st you haven't used some of the funds, you have 3 months after July 1st to use the funds. And then whatever you haven't used, then you
And you can't use it for like Tia's taking care of the baby at home, that's not motivating.
no.
Send you an invoice.
Unless Tia invoices you, then
Ooh.
Really? For real?
they ask for an invoice, they don't.
Oh.
Like, let's say
That's
if
a
it's
good
like a
idea for
county
a
kid,
kid.
like my son was part of
Claudia
Miami
will take
Cal.
care of
I'll
your
take
kids.
care of all your kids and I have
He was
invoices.
part of like Miami Cal, it was
Right.
like a county thing. Would that cover it as well? Cause there was like a tuition of like $300.
Is it a date? I'm not sure what Miami Pals is. A date?
It's like, it's where police officers and local kids in the neighborhood, they have like these camps, basketball camps, cheerleading camps, football camps.
So it covers it covers
So it
summer
can-
camps. Yeah, it would cover that. But if you
But
wanna
it's not
send
a-
me an email so I can like triple check with the TPA, I can do that. My email's the same thing in that first page, Jessica. Any questions on your FSA or?
I just don't understand the whole thing.
Okay, so FSA, it's a spending account, you can put in money pre-tax. So you say basically whatever your tax bracket is, that's the money, that's the discount that you're
You're,
gonna
you're
get.
paying for medical stuff with pre-tax dollars, so you don't have to, you know what I'm saying?
Do I have to pay for this thing?
Yeah,
Yes,
it would
you have
be
to pay for
deducted
it.
from your account every
Yeah.
check. Yeah.
Yes, so basic, yes. So you would save on your tax bracket.
She
I
still
know
doesn't.
you get the card, right?
It was not clear at all.
You can still
Someone
use
have
the same
perdón.
card. If you
Okay.
lost your card, we could always order a new one, but the cards for the FSA will be the same.
Same?
Yeah.
The AmeriFlex.
The American.
The Mary.
Yes. So let me ask you,
It's in 401k.
I had to ask questions. This is my dental insurance and I had to do this.
Card, 'cause it's
No,
in the
back.
pocket.
Dental, yeah. I swear to God, I still
Oh,
have.
I didn't.
can you send me an email and
The way that I'm gonna have to probably explain
You
everything.
can do both. You can pay. Okay, send me an email so that I can make sure that you have that card and then you could, okay.
I need it dummy proof.
Okay.
Insurance for dummies.
So really quick, Florida, if you have your Florida Blue app, it's gonna be active June 1st. If you wanna download it, so you have your ID card, you can search for your providers. You could also,
The cards won't be available till June 1st.
we'll get them prior, but you can't go onto the app
Oh.
until
Oh, well,
June
well,
1st. I know you guys are all dying to get on there, but just a few
Super
days, okay? Virtual visits, you have Teladoc. Blue Cross Blue Shield has these value choice providers. So there's one called Sanitas, Diagnostic Clinic Medical Group, and Guidewell Emergency Doctors. If you go to them, they have much lower copays. You're gonna see in your benefit summary called Value Choice. Sanitas is free. There's one right by the falls, if anyone lives down there. But they have this special program where when you go there, you have discounts and copays. And then Employee Navigator is where you're gonna log in. Your company identifier is WOW and KTG. If you're locked out, have any issues, our enrollment team is here to help. So now I'm gonna,
Just keep one page, 401k.
he's going right now, you beat me to it. Now I'm gonna kick it over to George so he can kind of go over the 401k.
Good afternoon, everybody. My name is George Valdez Jr. I'm a certified financial planner and part of your financial advisor team on the 401k. So any questions you have, whether it be with the 401k or even personal financial stuff or a financial wellness tool for you guys, whatever it may be. So I'm gonna go over why we chose the 401k compared to other retirement plans. Then I'll talk
You
about,
have to click the arrow.
and then I'll talk about your specific plan. So why 401k? So there's higher contribution limits in other retirement accounts. Not sure if anyone here has an IRA, an individual retirement account, but the yearly maximum for that this year is around 7,000, or with the 401k, if you're below 50, it's 23,000. I know it's a lot of money, but you have that capability. In addition, ease of automatic deductions. So it's never easy to get a paycheck and, send $100 to your savings account or to an investment account. You wanna go to dinner, you wanna go to a movie just like everyone else. Here with a 401k, it's deducted from your paycheck automatically. So by the time you get it into your bank account, the money's been sent to your 401k. Ability to change deductions at any time, so you're never locked in. Let's say you start contributing 5% of your paycheck, you realize that's too much, you wanna lower, you wanna higher it. You're never locked in, you always have the ability to make changes, it's flexible. Creditor proof, pretty much, God forbid any of you were to be sued, it's a retirement account that's protected by the government where they cannot go after that account. So it's protected from creditors. So tax benefits. So there's two ways where you can contribute to a 401k. There's traditional and pre-tax, and then there's Roth after tax. Feel free to stop me, this could be a little confusing if I clarify anything. So to give you an idea, let's use $1,000 check and $100 contribution. If you did a traditional pre-tax contribution, the $100 would go to your 401k account, and then you would be income taxed on $900. Now, when you go to take it out in retirement, that's when you would pay taxes. Versus Roth, you pay income tax on the full $1,000, and then the $100 goes to your 401k account. So the question is, do you want to pay taxes now or later? To give you an idea of why this traditional pre-tax exists versus Roth is, so you guys are working, now you have a salary with WOW. When you retire, the average American, through Social Security, any retirement or investment accounts they have, what they make is normally less in retirement compared to when they had a salary. So the idea is when you go to pull it out in retirement, you're in a lower income tax bracket, so you're paying less. Now, there's never really a wrong or a right answer. There's a lot of preference that goes to this choice. If you go and you talk to your accountant, they might say, do pre-tax to save on the taxes now, versus, in my opinion, I prefer to do Roth because there's a few reasons, but for example, the federal deficit keeps getting higher. We don't know where tax tables are going, so I prefer to just get my taxes out of the way now. But there's not a right or wrong answer. If you want to talk about it a little bit more one-on-one, I'll be more than happy to. Are there any questions on that? Jared, everybody? Perfect.
You can also switch from pre and Roth. So if you want to do some pre, some Roth.
Yes, never locked in, very flexible. You can make those changes whenever. So compounding interest, why is it and why is it so important? So pretty much it's just your money making your money on itself. So before I get into these three people here, I want to use an example of having $500 in an account. If you were to make 10%, that'd be $50. Now in year two, since your account is $550, if you were to make the same 10% as you did in year one, now you made $55 in year two because the base is larger. Does that make sense? So now we got Joe, Bill, and Tom. So they all put in $5,000 into their 401k account. They had a rate of return of 8%, and they all withdrew the account on age 67. Now, if you look at the bottom here, you can see the astronomical difference in account values. Now, why is that? Because time in the market. So Joe started at age 18, most responsible 18-year-old we've ever seen, but we got Bill at 30 and a Tom at 45. Now, why he had so much more is pretty much just time in the market and money and compounding interest. Any questions on that? Perfect. So now I'm going to talk a little bit about your specific plan. So eligibility, once you've been here 3 months, you're eligible to enroll into the plan. Entry dates are monthly. So let's say you started on January 15th. After your 3 months, you have to wait until the first of the next month to be able to enroll. When can you access this money? So retirement age, which they call early retirement, is 59 and a half, where you can take it out without any penalty. You just have to pay taxes if you did pre-tax or Roth. Then, God forbid you were to be disabled, you could get the money without any early penalties. And termination, if you were to leave WOW, the money you've put in there is yours. So you could take it wherever you go, whether it be another 401k, or an IRA. If you're ever in that situation, just reach out to me and I can help you, I can help facilitate that for you. Now, if you did need access to the money prior to age 59 and a half while you're still an active employee at WOW, the plan does allow for loans and hardship distributions. We never recommend taking money out of your 401k unless you absolutely have to. But, so there's loans, and then hardships is 6 situations such as buying a primary residence, preventing eviction, medical expenses, funeral expenses, and and then major repairs, so no pools or anything like a roof, something very important that needs to be fixed in order for you to live. Now, what happens with the money you contribute? It's invested into the market. You have a few options. So I'm not sure if anyone here is investor savvy. You can make your own decisions. There's a curated fund lineup for you guys with a bunch of different investments that if you want, you can make your own choices. 2, you could always call us and we're more than happy to help put something together. I just need to talk to you for 15, 20 minutes, understand your risk, understand you a little bit more, and I can help you put something together. And then lastly, there's something called the target date fund. So what is a target date fund? So when you go to enroll, you're gonna see something called FOIA index, and then 10 different years, 2025, 2030, 2035, all the way to 2065. So that's the year you want to retire. So someone who's, let's say, 25 years old and has 40 years to retirement, they would be in the 2065 fund. So these funds are professionally managed where they know, all right, since we have 40 years, we can take more risk with our investments in order to make more money, since risk and reward go hand in hand when investing. And then now, as you start getting closer to that age, someone who's in the 2025 or the 2030 fund, these managers make the fund a lot more conservative, now knowing, hey, they're gonna need this money in 5, 10 years. If the market were to drop 30%, that would throw their retirement off track. It would be a huge issue, so the investments are more conservative. We recommend these because it's like set it and forget it. You know, a lot of people aren't checking their 401ks daily, they're looking at the market daily, so that's normally what we recommend to start out with. Are there any questions on that? Perfect. Now, how do you enroll? So it's in your booklet as well, but it's pretty much going to this link or using the QR code. And then it'll go through the basic things of how much do you want to contribute, pre-tax or Roth, your investments. If you do enroll, please make sure you do list a beneficiary. God forbid anything does happen to you and there's no beneficiary listed, the account goes to probate, it could be a big issue and a lot of time wasted for one of your family members. Any questions?
I do have one question here in Zoom land. Turn on my camera. I don't know if you have any slides here, but could you talk a little bit about rolling over another 401k account into this one? Do you guys offer that?
Yeah, so that's part of something we'll help you with, Eddie. If you want, you can email me, but pretty much if you tell me the other provider you're with, we work with all, we're independent, so we work with all the carriers. I'll tell you, it's pretty much filling out a form for them, then filling out a form for Voya, letting them know checks coming and the amount, and then we mail it together. But I can help facilitate and give you guys the directions of what needs to be done to roll an account in.
Okay, cool. I'll send you an email. Thank you.
You're welcome.
We're still not matching, right?
No, not yet.
Sorry.
It's on our list, it's on our list.
And on the beneficiary, if you have a trust, can you include that on there as well?
So I will let you know, this runs into some funny situations. So according to the law, you have to list, if you're married, your spouse. If you do want to list anyone else, like I say, you want to put your spouse and your mom, your spouse has to sign off on that. So you have to get a paper signed by them, letting them know they're not 100% beneficiary. Just before any of you try to do that, and you know.
That'll be a
It could
fun
be a stick
conversation.
catch.
if there's some.
Yep.
Give him a glass of wine, I'm signing over.
I have a question.
Yes.
Let me just turn off the camera. So I turned it on.
What is it turning at that?
When you list the beneficiary, can you list your husband or your spouse and for the beneficiary of your kids? Because then they would be a secondary or tertiary.
Yes. And so you can list your husband or your spouse, but you can't put a minor as a beneficiary as well.
Oh,
So
you can.
have to put, you would put them and then, yeah, you could put the child for the benefit of. Is that
Okay, and then they would have to sign off on that as well?
It's kind of, no, on that one, they wouldn't have to sign off on it. It should be allow you to say, unless, would you do 100% just for the benefit of your child?
Yeah, if you had to do, say this account goes, and if it has to go with his name listed, but it should be, but you want it to be 100% for the child or children.
Yes, then he would have to sign up on that,
Okay, if it's just him for the beneficiary of, then what's the difference?
because he's giving up 100% of the account.
Okay, just curious. Thank you.
Any other questions?
So let me pop up. Affleck, did you send me Affleck?
Can you send me the phone?
1 second, we're putting up the Affleck presentation.
Thank you, thank you. Thank you.
Well, hi, everyone. Happy Thursday. For those who don't know me, my name is Marisa Farrell, and I'm here to tell you about the great things about Aflac and how they can complement your already awesome benefits. If you currently have Aflac, well, we wait for the thing to go on, and you're happy with your plans, which I hope you are, there is no need for you to take action. Aflac rolls over year to year. However, if you want to make changes, you want to add to your Aflac plans, you want to make any alterations, this is the time to do it during your open enrollment. So we're going to discuss 5 different policies. Each of the policies are independent, meaning that they don't correlate amongst themselves and they don't correlate amongst what you may or may not get through your company. You don't necessarily have to have the insurance through WOW to get Aflac. What are perhaps the key things that I would consider when I talk? I always forget it. Not screenshot. I'm so accustomed to mine.
Oh, it is.
It is. Me lo hace grande. Digo, no.
I would just click like,
Yeah,
it's on
okay.
the top right next to
So
the
anyways,
report.
a couple of things that if you don't know Aflac, what's so different about Aflac? Well, first of all, it's not health insurance. It is supplemental. It is there to help you with those costs that insurance was meant to help. Further than that, you're the one who receives the cash benefits. So that is a huge plus. A lot of times we can get on a payment plan in the hospital with the doctor, but there are some things that we need cash now to pay, whether it be your mortgage, whether it be your lease, whether it be the school of your kid, what have you. You are the one who's going to receive the cash benefits. Whether it is $500 or $60,000, the IRS does not deem this as income. You don't report that money and you don't pay taxes on that money. All your policies are portable. Perhaps one of the biggest ordeals when we switch jobs is what happens. We miss out on these great opportunities, these great benefits, and we start from clean again. Well, with Aflac, what WOW is doing is giving you the opportunity to get these plans on a group rate, which is significantly lower, but also these are your plans. And Aflac promises never to increase your rate. So what happens when we get older? And I'm learning this very fast. Things just get really expensive. Everything gets expensive. Well, with Aflac, you actually lock yourself at the age you are today. Lastly, all of your dependents can be on your plans until the age of 26, except for short-term disability, because short-term disability, it only protects you because it's a paycheck protection. And lastly, again, should you currently enroll in Aflac and you need no changes, no action is needed on your part. Voila. So I always like to start with short-term disability because after health insurance, I feel that this is probably the most important policy to consider. Why do I say that? Because it's a paycheck protection. Let's talk about a scenario. Let's say I got into a car accident. I go to Baptist or South Miami. I have insurance. I have my gap insurance. Thank God it's not that expensive. I come back home. I'm recuperating. I call Dai. Well, how much vacation time do I have? How much PTO time? I've used up my vacation time. I've used up my PTO time. How am I going to pay those bills that keep coming in, even though I'm home recuperating? That is what short-term disability does. Short-term disability is going to pay up to 60% of your annual income for the duration that you want. In your case, your company then comes in with long-term, so you really only need to cover yourself for 3 months. I mean, you can go 6, 12, but honestly, for your realistic point of view, 3 months, because then God forbid that disability was longer, your long-term disability is going to kick in. So I would encourage you to consider 3 months. As of May of last year, Aflac also included mental illness. A lot of short-term disability carriers do not include mental illness, and Aflac does. So how do you know what your rate would be? Well, there's a lot of things to consider. For starters, it's going to be based on your annual income. Everyone here has a different annual income. Secondly, your age. It is an age band policy. And remember that with Aflac, once you enroll, you lock yourself at the age. Elimination period. This might be a little confusing. All you need to know is that the first number pertains to an accident, the second number to a sickness. So if I tell you that you have an elimination of 0.7, what that means is if I get to an accident, 0-day waiting. I got into the accident, I call Marisa, we file the claim, Aflac starts paying me immediately. 7 is for a sickness. So with a sickness, I have to wait 7 days, and then Aflac starts paying me. You can explore a 0.14, a 7.7. Obviously, the longer we wait, your rate is going to go down. That is a very personal question because maybe I can't wait 14 days, but maybe you can wait 14 days. So it's more about how you feel, how much savings you have, what kind of position you want to put yourself. So you do have 3 different elimination periods. When it comes to maternity, it's a great policy because it pays maternity. 2 key things is that you have to consider the elimination period for your maternity, and it pays either 8 weeks for C-section or 6 weeks for a regular birth. And lastly, again, you would be able to choose from 3, 6, or 12. Again, in your case, 3 would be more than sufficient due to the fact that your company offers you long term.
With the maternity, can you give them that clause of what the waiting period is?
Yes.
Or short-term is
Absolutely. So besides the elimination period, with maternity, and if you read the brochure, it can be very confusing because it says it will not pay benefits at, 10 months. And people call me, they're like, I have to wait 10 months before I get pregnant? No, it has a 30-day waiting period. What that means is if you do not have short-term disability currently, and you're thinking of wanting it for maternity reasons, your plan becomes effective June 1st. You cannot conceive until July 1st. So those 30 days, you can practice, you can do whatever you want, but you cannot conceive. I'm telling you, they will not pay you the benefits. It's happened to me, and we're talking about maybe 2 days, 1 day before turning the 30 days, and they will deny it. So maternity, thank you for that big emphasis. You need to wait 30 days from the effective date, okay? After that, we're clear. Just for an example, this is based on a 0.7. This would be the highest rate that you would probably get. Most comparable is probably a 7.7. But just for an example, let's say I make 47,000. What Aflac gives to me is 2,400 post-tax, so I don't have to worry about my taxes. And depending on my age, and we're going to focus on the 3 months, you see that it would be 31.20, 39.0, 45.20. Any questions on short term? This is one of my
What were
favorite
those-
policies.
I'm
Yes.
sorry, can you go back, what were those 30, 41, what is that?
Oh, sorry?
What was the 41? You said it pays you 2,400 and then you showed 41, 34 and whatever by age, what is that?
Okay, so if I made 41,000, what Aflac would pay me post-tax is 2,100. If I am anywhere from 18 to 49, I would pay 27.30, 50 to 64, 34.13, and 39.59.
And
Did I
that's
answer
per
the
pay
question?
period?
Yes, per paper.
Per
Okay.
period, yes, semi-monthly,
Okay, that's my question, thank you.
of course. And whoever's asking, also, the nice thing about Aflac short-term disability is when you usually do group short-term disability, the platform automatically already gives your age off. You guys can actually contemplate, should you want to, go down the scale. So after you do your calculations, maybe you say, you know what, I don't need 2,000, I'm okay with 18. So you can go down the scale. What we can't do is go up the scale. If that helps any, okay? So believe it or not, this is the way Aflac began. The Amos grandmother got diagnosed with cancer and they said, whoa, what a horrible disease. Not only emotionally, physically, but financially. Yes, your health insurance is gonna come in and pay the big bucks and you will have big bucks to pay. But I guarantee you, I've been doing this too long to know that you will have out-of-pocket expenses. And they don't necessarily have to be medical expenses. They could be things such as, I'll give you an example. One of my coworkers, his wife got diagnosed with cancer. She was the one who had to pick up the kids at work. He can't go pick up the kids at work. They had to get a driver to go pick up the kids, come home, help with all those expenses that you don't think because of cancer, they started accumulating. They started eating a lot better, organic food. It gets expensive. So for them, it was like, wow, I'm gonna get this influx of cash coming in. And it's not really necessarily to pay my medical, which it will, but it's to make my whole organic life better. All my, my today work better. To this day, his name is Stefan. I get a little text. Marisa, thank you so much. Thank you so much. This has helped us. And it's continued to pay because this policy has no lifetime max. So this will stay with you until you fight this horrible disease. So instead of me going line by line, I want you to kind of look at this more wholesome and just look at the influx of cash that you would get to make your life a little easier. 3 things I'm gonna highlight from this policy. One is that there are 3 levels. They're exactly the same policy. It's just the amount that you're going to get. Level 1 is gonna pay you less than level 3. Second thing I wanna highlight, to this initial lump sum that you see here, that is the first thing Aflac is going to do. We get the positive pathology report. This is the one claim I don't want you to worry about. Call me, please. Tell me the bad news. We start the process. This is the first thing you're gonna get. That's just for you to get your mind going. Where am I gonna go? Do I wanna go to a cancer institute? Do I wanna stay here in Baptist? To that amount that you see, Aflac is going to add $500 every year you keep this policy and you are cancer-free. It grows in value every year. So what I am doing with my 2 boys, I have 2 boys. They've been in this policy for almost 10 years. Right before they turn 26, I'm going to port out that policy. But for the past 10 years that Aflac has been adding those $500 to their initial lump sum, that will get transferred to their policy. So this policy grows in value every year. And lastly, I want you to see the difference between just including yourself and including your dependents. Whether you have 1 dependent or 10, it's the same cost, but it's basically cents. So if you do have dependents, please add them to your plan, because not only, God forbid, it is one of your dependents that gets diagnosed, that plan is going to double that first occurrence lump sum, and it's going to give you an additional $10,000. Besides all the great other benefits, it does give you a cancer screening. And if you recall, Jessica told you that if it's your preventive annual screening, we don't pay for that. Aflac is still going to pay. Level 1, 25, level 2, 75, level 3, $100. That is for everyone in their policy. Believe it or not, I have a client that has 11 because they're 2 divorced. So they have 11 kids and them 2. Every year they claim their 12, 13 cancer screenings.
That's a lot of kids.
Okay. Okay, so honestly,
Okay.
if anyone does any kind of sport,
Okay.
anything, this is a great policy. As I just told you, I do have 2 boys. They both play college. One plays lacrosse, the other one plays soccer. And while they were in high school here, boy, did I use this so much. It came really handy. It got to a point that I hate to be a bad mom, but my kid would be like, Mommy, I think I'm hurt. I'm like, are you sure you're hurt? I mean, like, but at least this kind of helped me, like, okay, I don't have to pay the copay. At least it kind of incentivizes you to do the right thing. The only thing that this policy asks of you is this first initial visit. If you have an accident, do not wait for a week. Do not wait for, go see someone. Urgent care, I think it was $50. Anywhere, your primary. It doesn't matter where you go, get a proper diagnosis. You're going to get paid for that proper diagnosis. That is how the claim starts. But then if you go down the list, all of these are the benefits that you would receive per accident. So you've got follow-up visits, you've got physical therapy, you've got, hospitalization, ICU, ambulance. It has a death benefit included. That's a pretty big range, right? 50 to 187. It depends on how the fatal accident occurred. So if Dai and I went jumping, our payout is going to be less than if, let's say, Jessica and I had a car accident. So that is why there's a range. It includes any accident worldwide, 24/7. The only thing it does not include is pregnancy, because I've been told that pregnancy is not an accident. But besides that, it will cover any accident. So yes, no caps. And this is the only policy that Aflac offers that there's no waiting period. So June 1st, you have an accident, we are covered, we start the claim and you start collecting your monies. If you had the accident policy, you know you have an annual wellness. That annual wellness was $60. As of March 1st of 2024, Aflac upped it to $90. So every year for any doctor visit that you went to, dentist, eye doctor, annual, OBG, dermatologist, chiropractor, it doesn't matter what doctor, you're gonna collect $90. These are all based on honesty. There's no receipt you need. You go into your portal and you submit your claim.
And Marissa,
Yes.
with the, right there, the employee where it says 1060 and then 215, the
Thank you.
215.
I don't think I have presented this, and I'm just throwing it out there, because I think for this price, it's called the accidental death benefit rider. And what that would give you, I guarantee you an additional 35,000 2-year death benefit. So it gives you an additional 35,000. Thank you. So someone very smart today asked me, what's the difference between GAP and a hospital plan? Between GAP, the hospital plan from Aflac and the GAP insurance? And I said, that's a really good question. There's a lot of differences. If you decide to go for the GAP, I would not get the hospital plan. Not necessarily because you're over dipping. So if your concerns are your deductible, you're just scared of that high deductible, God forbid you were hospitalized, gravitate to the GAP because it's gonna pay off that, high deductible that you're worried about. However, if this plan, the advantages would be that A, you keep it, 2, that it pays you. So, but honestly, between the GAP and the hospital, I would pick one or the other. I wouldn't pick, both, because you're gonna be really overextending yourself for no reason. More importantly, also with hospital, Aflac, you can only go up to 2,000. So in the case of the 7,000, I think it was, it's gonna help, you still be out $5,000. So perhaps the GAP insurance would be a better fit, if that's what you're looking for. But yes, this is the hospital plan. It is an age band, meaning that you would lock yourself into it. And you get to decide if you want to cover yourself for 1,000, 1,500, or 2,000.
But you don't need to have the hospital to just have the other plans, right?
No. These are completely different. You could pick one, you could pick all of them. And Aflac per se is not going to tell you, oh, but we paid you the hospital in the accident. No, they're gonna pay you per policy that you have. This one, I think, is probably the most overlooked policy, and I don't know why. It's extremely rich. I think it's extremely well priced. Believe it or not, I see a lot of women here. Guess number 1 reason for a women's death? It's heart attacks. I always thought it was more of a male condition. Women die of heart attacks more than any. That is our number 1 disease, heart attacks. Why not have an incredible policy that is extremely well priced, that is extremely well, very competitive with its benefits? So it works a little bit like the cancer policy in the sense that it is going to be adding $500 to that initial, God forbid you had a critical illness. What is a critical illness? You had a heart attack, stroke, coronary bypass, a 3-degree burn, an organ transplant, any of those things, a coma. You would receive that first occurrence lump sum, which grows every year that you keep it. It does have a reoccurrence benefit. Let's hope we never have to use it. But let's say I had a heart attack in 2024, and then in 2028, I had a stroke. I can always count on that reoccurrence benefit, no lifetime max. But then if you go down, you've got the hospital, steps down to the ICU, you've got continuing care, heart surgery, tier 1 and tier 2. Again, remember, this is a very young crowd. You guys can lock yourself into the age you are today. And last but not least, you may want to explore what's called juvenile whole life insurance. Do you all know the difference between whole life and term life? The best way I would describe it is think the difference between buying a car and leasing a car. When you lease a car, what happens? Every month we have payments, right? And then we have the lease for 2 years, 3 years. After that lease is over, we go back to the dealership, we give in the car, and we're done. The car's back, but we don't have any more payments. That's term life. Think about when you buy a car, you still have payments, but at some point you have what? Cash back. The car has value of something. You can resell it, you can do something. That would be whole. You, of course, you're gonna pay your payments your whole life until you have you pass away. But for juvenile, the reason I want to bring this up is because one, the build of cash value that they can use it in the future for something that they may want. But more importantly is because I think it's very well priced. So for juvenile, you can pay 10, 20, or 30. But the nice thing is that when your dependent turns 18, the amount that you elected is going to double, but your rate will forever stay the same. This is a thing, this is what we would want to encourage them to continue with this policy when they get older and they continue with policy for the rest of their lives because they're locked into this one rate. So as a friendly reminder, for those, I think most of you, I have 3 people that I brought you that have not collected on their wellnesses. There's someone who has a lot. Not gonna mention who.
You don't have to, I'm sure I know who it is.
So most of you are really up to date with your wellnesses, thanks to Dai, who, wrote me an email, well, can you let me know who? So just for you to know, your accident policy now has, it says 60 there, but it's 90 now. Your cancer policy, depending on your level, has one for everyone. And your hospital choice has physician visits. Again, this is based on honesty, no receipt needed. If you currently have Aflac or you're thinking of getting Aflac, please download their app. It is so easy to use. You can submit your file right there. You can check on your policy. You can, all the information is there. It's so easy. It's great. I love it. So I just brought a couple of brochures because we're trying to be very paper conscious. So I did bring some brochures, whoever wants to take them. But also you can do the scan of the QR and the same presentation that I did will be up there with the different rates. If you want to enroll, there's a couple of ways of enrolling. One is that you and I can have a one-on-one right after now, or we set up a call. I call you and I can enroll you over the phone, or there's a form that we can fill out. I give it to Dai, Dai sends it to me, I enroll you, I always send you a confirmation. I can vouch for these plans. I love these plans. They really have come very helpful to the people who have them. A lot of times I feel that people don't know how to use them. So that's one thing I can tell you. I am here to help you. I am here to hold your hand. If you need me to file your claim, I will file your claim. So I'm here to guide you, help you so that it doesn't seem that overwhelming. After a couple of years of you having Aflac, you start doing it yourself and you're like, oh yeah, this was kind of easy. But I'm here all the time. So if anyone has any questions, otherwise your plans would become effective June 1st. Remember that all of them do have a 30-day waiting period except the accident policy.
Thank you.
Thank you. Thank you for your computer. Absolutely.
So that is everything for today. We'll be here if anyone has any questions. If you need my email, like I mentioned, it's Jessica@MD-National. Any one-on-one you want to discuss, shoot me an email. We can set up a time. And I look forward to working with you guys this year. Thank you for your time.
Thank you. Of course.
Okay, perfect. Thanks.